We stay in Africa and we have one more pitch for you. And this is King from Rwanda and his project Lifeline.
All right. So, hi everybody. My name is King and I'm from Lifeline. And yeah, we are basically Africa's first medication/clinical software with third-party insurance integration. We help people access healthcare at nearly zero cost. And I'm just going to ask everybody this question. Who here has ever been, let me say, screwed by their insurance? If you have ever been screwed by your insurance, you can just raise up your hand in the chat. So yeah. And we're actually going to look at the problem statement and metrics. But first of all, I actually want to tell you guys why Lifeline actually began. So you see, yeah, during my college years in Rwanda, I went to a pharmacy one day to get my medication, and unfortunately, the pharmacy had my medication, but I'm sorry, King, we don't support your insurance here. Quite a crazy situation. The next pharmacy supports my insurance, but they just actually ran out of the medication I needed. And this is actually me stranded on a Saturday morning and I actually needed these things as quick as possible. And you see, as a college student, finances was quite tight. So, I mean, I have insurance, but I just literally couldn't use it. So, and unfortunately, I'm sharing this problem with 269 million people on the continent, whereas almost 80% of Africans cannot afford healthcare at critical times when they need them. I was literally one of them. I am still one of them, kind of. And 95% of the population literally lacks insurance at all. And because of this problem, basically, 1.6 million people have died as a result of this. So, with all this story and all this data, what is my problem statement basically? Gaining access to pharmaceutical and clinical products in life-threatening emergencies is a very frustrating case. It can be frustrating. Affordability is a very big barrier for many patients while trying to manage their health expenses. You see, one thing I actually understood about working in Lifeline is not everything accessible is affordable. Accessibility and affordability are very different things. And lastly, millions of people on the continent are struggling to keep accurate record of their medication and clinical data. I'm just going to pause here and ask everybody this question again. If you can keep track of every single medication and clinical tests you have done and taken in the last 1 to 10 years without the help of your local pharmacy, hospital, insurance company, please, just raise up your hand in the chat. That would be really cool. But most people actually can't. Millions of them actually. So, what is my solution here? I present to you Lifeline. This isn't just some app that we actually built. It's more like an ecosystem that does three things basically. Helps you access, afford, and manage life-saving medications and clinical tests at nearly zero cost. Basically, at Lifeline, we are promising you healthcare for free. I know it sounds insane, but we're literally able to pull it off. How does it work basically? You see, we're actually able to customize our own GPS on the mobile app, whereas instead of Google Map just showing you where a pharmacy is located, you can literally find the medications based on your geographical location as well as test. And at the same time, we also introduce the outpatient care tracking. The question I asked everybody previously, can you keep track of this medication and clinical data on your own without help? Now you don't actually have to think about it anymore. Every single one of your medication and clinical data is actually logged in on blockchain and it can't actually be changed or tampered with at all. And we also have drone support for people who live in the rural areas because I mean this is Africa. Not everywhere a vehicle or a motorbike can actually get to. And we actually work with Zipline here in Rwanda and they already ship medication. So they already transport blood with drones and we're like, hey, can you guys also transport medications with these drones to people in the villages? And it was quite crazy, but we're actually able to pull it off. We've done about 500 drone deliveries with Zipline, and we're the first healthcare company in the continent that allows you to use your insurance remotely from anywhere in the world. So let's say, for example, now you're in Austria and you actually have an insurance there most insurance companies do actually work outside the particular country. But as with Lifeline, if they actually work with us, you can actually utilize your insurance even in a different continent. That's currently what we're doing right now. And for those that don't even have an insurance at all, we literally built an insurance search engine to also help insurance companies generate revenue by selling insurance premiums to people that actually want to buy an insurance. You see, the reason why 95% of Africans don't have insurance is it because they can't afford it. I know that most people can't. But insurance companies make it very difficult for people to even make these purchases. You have to have a lot of calls, a lot of emails, and all that. So basically, with just a few clicks, AI can actually help you get an insurance policy based on your budget. And what is our impact so far? Lifeline is actually about 1 year old, but although, I mean, the company on paper is 1 year old, but we've actually been operating for like 6 months. We started our beta testing in September, and as of January, we actually started our public testing. So we're not like fully public yet because of, working with different insurance companies, it's quite a lot. So we're just trying to like take it one step at a time. But so far, we actually have helped about over 3,000 low income earners access free healthcare with a subscription. Because you see, part of the reasons why most people don't have insurance because it's quite expensive. Not everybody can actually pay $500 to $1,000 a year. That's literally like their yearly salary. So we actually introduced our own micro insurance within Lifeline that just starts at $2 to $3 to $5, and about 3,000 people have actually purchased this, and most of them actually university students. And at the same time, I've helped over 243 healthcare providers increase their visibility by 300%. Because I mean, one thing I tell people is that Google Map we actually tell you where a pharmacy is located, but it's not going to tell you what medication they have, what insurance they take, and if they're actually open. So with Lifeline, basically, we became like that Google search for people that actually are seeking certain healthcare services. And in literally 5 months, we've processed over 200K in healthcare transactions across over 200 healthcare providers that work with us. So we're a very lean company, and then we're just nine of us from 6 African countries. This is I myself. I'm a programmer and a two times founder. I also have Good Luck, my CTO, as also a software engineer. And then we also have Mohsen, head of product design. And we're 60% of the team are actually females, which I'm really proud of, honestly. So these are a board of advisors. They actually have over 100 years of experience combined, helping us in every step of the way to actually make the right decisions. Because in as much as I'm a two times founder, I don't really have a lot of business experience. So I actually rely on these guys to like help us shape the business model and make sure we're doing the right thing because the healthcare sector is really, really regulated and it's quite tricky. So, when the cost of health is impossible, we are your lifeline. Thank you so much. So, this is our website, and if you actually want to reach out to us for partnerships or anything, this is our email. You can take a screenshot or anything. And then we really appreciate WSA for actually giving us the global recognition and a platform to actually share our story and tell the world what we do and support us. Thank you so much.
Thank you, King. Any questions?
Sorry.
Lifeline is what you have described is an incredibly ambitious system.
Thank
It's
you.
an ecosystem more than just an app. And I really
Awesome.
appreciate that. And I think it's, from my point of view, what is really interesting is that healthcare is an incredibly wide area. I mean, it starts if do you have access to a dentist? Do you have an obstetrician for, birthing? Do you get contact to a midwife? Is there somebody there who is looking after your cancerous melanoma? So that's a huge, huge area. Where do you see that there's the most demand for Lifeline, and what's the profile of the user which you have? I mean, we are all always, in terms of WSA, we are always driven by the product, by the solution, by the application. But I want to get a little bit more, a better feeling of who is the user and how are they basically interacting with you, and what is their understanding of what they can benefit from. Please, King.
Thank you so much, Peter. Lovely to answer. So originally, Lifeline, when we actually started, we started with pharmaceutical, helping people actually find their medications cheaply and actually faster. But there was a problem. Like I said, not everything accessible is affordable. And what's actually going on in the healthcare system right now is a lot of monopoly, because most of these other companies, like big pharmacies, they just have websites that only sell their own medications, literally. And they actually take advantage of the fact that, for example, in Rwanda, there are 770 pharmacies in this country, and only two of them have websites. So literally the rest of them just rely on WhatsApp and actually emails and that sort of thing. And only two pharmacies could actually come out, build their own website, and actually give themselves the visibility. So you can actually go online and you can actually see like ibuprofen for like $2. And
Yeah.
somebody else might actually be selling it for 2 cents. But the problem is that you don't know. And as tech-savvy individuals, we don't actually have time to be driving around. So basically, we just actually we actually purchase from the first person we see. And actually saw that as a problem because a lot of people actually selling things more affordably and even have better quality, but nobody actually knows where they are, basically. So we actually started with pharmaceutical, helping you get access to your medications faster and cheaper. But then there was a problem of affordability because not everything, like I said again, not everything accessible is affordable. And I was like, wait, I pay for insurance every single month. And I've literally not used this thing. Why is this actually the case? Because one thing I actually notice is that insurance companies make it very difficult for you to actually use this thing. In fact, the first fight we had with the company was the insurance companies because when they saw what we did, in fact, it kind of broke their entire business model. It's a very big problem for them because now they are at risk of actually losing a lot of money because now I've actually built this tool that allows people to use their insurance anywhere in the world. It's just quite insane. So, but then we actually did three things for the insurance companies. Basically, so for the pharmacies, we were able to actually give them visibility and increase their revenue. So for the insurance companies, we told them three things. We're going to help you increase your visibility. Let's say you guys actually come to Rwanda right now. You want to buy an insurance for the 3 months or 6 months you're going to be here. The first thing everybody's going to do is Google. And when you Google, you're actually going to find yourself calling these guys, sending them emails back and forth. We built an insurance search engine. I really just spent company money building a search engine for them so that instead of you manually calling these guys, AI basically finds the best policy for you within seconds. And if you actually want to pay, you can actually pay on the spot. So now they've actually increased their visibility and also helped them increase their revenue. Now, and at the same time, on the patient side, we also we actually improve their customer experience because you see, typically, if you want, let's say for example, Nora comes to Rwanda, if she wants to use her insurance, that kind of thing, she has to physically visit the facility. Now with Lifeline, she doesn't need to physically visit that facility. Lifeline is like Amazon, you go there and shop and get anything you want. But during checkout, we don't just allow you use your own money. We are like, hi, do you have insurance? Put in your insurance membership here, and we actually authenticate it instantly. If actually Nora has an insurance with this company, we can see it. We are literally plugged into the database within seconds. So, and then you can actually use your insurance as a payment method. That's why we actually say healthcare
Okay.
needs cost.
Got
Yeah.
it. Got it.
Thank you, King. We have another question from Babak.
Thanks, very nice. I don't have a question actually, but a remark. I seem to remember that this year's winner from Sri Lanka operates in a very similar space, also in connection to delivering healthcare products to already insured individuals, I believe. But the matchmaking is very similar, I believe.
I'm very
So it
happy
might be
to
worth
make
to
an
explore that.
introduction. Yes.
Yeah.
Are there any more comments, suggestion, questions? Or does King want to share how the WSA community can help him, support him? No, Amos. We have a question from our national expert from Nigeria.
Right. Thank you so very much. Thank you so very much, everyone. In fact, actually, I just witnessed an inspiring set of pitches, since we started, and it's quite fun. And I was so happy when I saw Peter's mail last night, and having it today and witnessing this is I'm grateful, particularly in fact, for everyone, not even for the last speaker. Everyone did very, very well. In fact, as an expert and an innovator myself, I'm very proud. And I will continually get impressed by the rising wave of purpose-driven solutions, shaping our world like this. And to WSA, I say kudos and apologies. Again, I couldn't make it Rabat once again, but I really plan to. In the house, I can see some real good faces. Faces that I've missed in Hyderabad. I can see Dorothy. I can see, I don't know whether, okay, I can see quite a lot of other people there too, actually. But then, not to waste your time, I say thanks for all the presenters. And quite frankly, you guys have you've done very well. In fact, your defense was also superb. And I say thank you once again.